Pete, there are nearly 1,000 active cases of coronavirus among Victorian healthcare workers. That's a figure that's nearly doubled over the past fortnight. 2 weeks ago, there were 400 active cases, so it's increased by 600 about over that 2-week period as well. Over the entire course of the pandemic, 1,725 healthcare workers have become incapacitated as a result of contracting coronavirus. An even higher number as well have been placed into quarantine or self-isolation as a result of being identified as close contacts either through their workplaces or through friends and family. Now, this has prompted fears of shortages in our hospitals, although Premier Daniel Andrews is confident Victoria does have enough medical professionals to see it through the course of the pandemic. Now, bolstering the workforce here, medical teams from the ADF as well as nurses, doctors and paramedics from interstate. The latest contingent are nurses from WA who will arrive here in Victoria later on this week. Yesterday, Victoria recorded its deadliest day of the pandemic with 17 deaths recorded in a 24-hour time span. It means that this month alone, 97 Victorians have died as a result of coronavirus. That's higher than the figure for all of July. In some positive signs, though, the active daily caseload, the average active daily caseload, I should say, is starting to come down, and it has at the very least stabilised well below that terrifying peak of 725. As well today, Pete, there's a bit of a change in protocol. The daily coronavirus numbers will be released by the Department of Health before the daily media conference with the Premier. That, of course, comes after weeks of leaks from that department.